smarter. IQ went to 99. Next up, we have Chief Scientific Officer, Jason Vega. Jason. He likes to make notes.
His head was red carpet.
We made a Hollywood already. They take Hollywood.
Non-engine. I have no slides, so I'm just going to hear me talk. But I appreciate the opportunity. I'm with ANX Robotica. Got James Vega, Cody Post, my partners here today. But what we did is kind of revolutionize capsule endoscopy. I believe capsule endoscopy was a capsule revolution. Way back in 2000, about started in the 80s, but really 2001, this capsule came about where you could swallow a capsule and the first time seeds are inside of your small intestine, which really changed the dynamics of GI endoscopy from that point on. So what we did is we now have AI software that goes along with that, where now we can tag the top 10 things why someone potentially has suspected GIB. We also have now a capsule you can put on a tether, where you can swallow a capsule. Someone can move the tether of the capsule up and down your esophagus, look for potential Barrett's esophagus, which is pre-cancer esophageal cancer. All this is done non-sedative, no radiation, no sedation. Take all the social determinants health out of it, accessibility, transportation, and that type of stuff on. Then on top of that, in the room back over here, where we really came most famous for is we were able to first develop a capsule where we can drive it in your body. In real time, again, no sedation, no radiation, looking for gastric cancer. But that has even expanded on about 8 months ago, someone in San Francisco swallowed a capsule, and I drove it in her body from my house in Gulf Shores, Alabama in real time. So you can see what this capsule revolution is continuing on to maybe one day taking biopsies. There's biomedical literature showing that already, aspirated fluid, chemo spraying for people in blood in real time. All that stuff's already been in the literature for 10 years, but for a company like us that R&D's everything, disseminates everything, localization, all that type of stuff is in the forefront of the next frontier of capsule endoscopy. The magnet, which is back there, where we can magnetically control a capsule, and now we wrote an algorithm, basically an AI algorithm. It drives the capsule for itself. By someone watches the screen, evaluates your entire stomach, you can pause it, drive it all wherever you want, resume, and the algorithm remembers where it's at. All that's done in about 9 to 11 minutes. Patient gets their results, and then the patient leaves from that point on. So, capsule revolution is here. We're proud to be partners with Ernie and Dr. Rohan on this, and what we have now is just the beginning. Just imagine if we have AI, we can drive it remotely, in visionary physicists and engineers, and the world's an oyster. We're going to be able to help a lot of people treat disease earlier, find disease before it's even a problem, and hopefully help them have better quality of life from that point on.